Okay. Hello, welcome everybody to our second keynote speech and to our second day of the conference. We already had one presentation in the morning, which I hope many of you could enjoy. And now we will move on to our second main speaker, Professor Angela Druckman from the University of Surrey. Welcome, Angela.
Hi.
She's an engineer by training, and currently she's professor for sustainable production and consumption at the University of Surrey. Angela is also part of the Center for the Understanding of Sustainable Prosperity, where she's leading the systems approach to sustainable prosperity theme. Well, she has a lot of experience. She's a member of the editorial boards of the journals Sustainability and the Journal of Industrial Ecology. And today she will talk about something that is really entangled and at the heart of any lifestyle any of us lives, actually. And that's work. So we're very excited to have you, Angela. And we will start your talk. And after the talk, you will be available for questions from the audience, right? So please, everybody, feel free to write in the chat. And I give you the floor.
Hello and welcome. I'm Angela Druckman from the University of Surrey. I hope you're well and coping okay with the strange and hard times we find ourselves living through. I'd like to thank the organisers for inviting me to do this talk today. So, like many of you, I've been watching with horror as the coronavirus pandemic has unfurled during the last few months. And as I guess many of you have been doing too, I've been trying to find a silver lining. So I've been asking myself, what long-term good might come out of this dark episode? What positives can we take from it that will lead us to more sustainable lifestyles in the future? So I've entitled my talk today, What Have We Learned About Sustainable Lifestyles from COVID-19? And I'll be focusing on jobs in the health and social care sector. Like I expect many of you have been too, I've been gripped by the media coverage, which has highlighted the necessities that we need in our daily lives, the basics that many of us generally take for granted. We need food, and yet the supermarket shelves were empty. The crisis showed the fragility of our just-in-time food systems and their lack of resilience. We started to appreciate the sterling work of healthcare workers, showing our appreciation through cheering in the evenings, which started in Wuhan, China in mid-January, spread to Italy and then to many other countries, including the UK, where I'm based. We also started to appreciate what we've lost, the social contact with our friends and family. And many people also suddenly felt the loss of the routines that used to underpin the rhythm of their daily lives. And in many places, people lost access to green spaces, despite the well-known fact that being in nature is good for mental well-being. And many jobs have been lost. All of a sudden, we have the concept of key workers and protected jobs, the jobs that are needed to keep society functioning. And it turns out that these jobs are not those of the financiers or the stockbrokers. They are the people who supply us with our food and look after our health and dispose of our rubbish. We suddenly began to appreciate the role played by these workers, who are generally low paid and to whom, until now, we've paid very little attention. In 2018, David Graeber published his book on bullshit jobs. In it, he asks, what would happen if an entire class of jobs were to disappear in a puff of smoke? In his analysis, he shows that many of the jobs that we do are basically useless. For example, he quotes a YouGov poll that asked British people, does your job make a meaningful contribution to the world? An astonishing 37% of people said that it did not. In other words, they admitted that their job was pointless. Furthermore, he finds that doing a pointless job, even when the conditions of employment are good, doesn't make people happy. People reported that it can be exasperating, insufferable, and oppressive. Of relevance to our discussion here is that the economic value of jobs and the wages that people are paid to do them is often in reverse proportion to its social value. Graeber gives some examples. According to his figures, a city banker earns around £5 million per year. But while doing so, he destroys a social value equivalent to £7 for every pound that he earns. Similarly, an advertising executive earns a bit less, around £500,000 a year, but he destroys even more social value per pound earned, £11.50 by Graeber's figures. At the other end of the scale, a worker in a recycling plant earns around just £6.20 per hour, but generates a positive social value of around £12 per hour per pound earned. Now, while we may dispute the actual figures here, COVID has underlined the perverseness of this. So I've been reflecting on some work that Simon Mayer and I carried out last year, exploring the importance of jobs in delivering well-being and what a more sustainable economy may look like. So the plan of my talk today is to talk about health and social care as a sweet spot of good work, and I'll explain what that means in a minute. We'll talk about why jobs are important in our lifestyles, what are the characteristics of good jobs, and of course, are jobs in the social and healthcare sector good jobs? Why do we perceive the care sector to be unaffordable? And what is the role of technology as we move forward? And finally, I'll conclude by talking about what we can learn from COVID-19 as we plan our new futures. Our work drew on a hypothesis put forward by Tim Jackson in his book, Prosperity Without Growth. In it, he put forward the hypothesis that health and social care is a sweet spot of good work, and that sweet spot is where you can have high numbers of jobs that are relatively low environmental impact, and the jobs themselves are good jobs. So in this talk, I want to explore the prospects for jobs in the health and social care sector in the light of both the COVID pandemic and the threat of jobs being displaced by technological innovations such as robotics and artificial intelligence, and to learn what this may mean for more sustainable lifestyles in the future. Let's look first at the evidence that jobs in the health and social care sector are relatively low environmental impact. So we're looking at the bottom right hand lobe in this diagram of the sweet spot of good work. This graph shows the greenhouse gas intensity of employment. So what we've got here is personal and social services. Now this will include the care sector. And what we can see is that the greenhouse gases per $1 million of final demand are very low. That's the y-axis, and yet it's very far along the x-axis, which shows that it's got a high number of persons per £1 million final demand. So this means that it has high intensity of employment, whereas the greenhouse gases produced per £1 million of final demand are low. Now that's good news, because it means we can have low environmental impact jobs in this sector. But if you think about it, the sector can't work on its own. It has to be supported by, for example, the utilities. We need electricity to run the lights and the computers and the ventilators, etc., that are needed to keep people, to run the hospitals, etc., and to look after people in care homes and in their own homes in the social care sector. And we can also see that machinery and equipment, as we've seen, that we need more and more ventilators, we need personal protective equipment or PPE to run safe care services. So these sectors can't work on their own, but it still says that we have good prospects for the personal and social services sector to be a low environmental impact, high employer. So now let's look at another lobe of the sweet spot of good work. Let's look at good jobs. We'll investigate what is a good job, but first let's briefly look into why good work is important to our lifestyles and to our well-being. Employment provides more than a livelihood. It's more than about money once you have a certain level of income. A job provides a social framework and a sense of being useful and wanted. If we draw on the psychology literature on subjective well-being, the literature divides subjective well-being into hedonic and eudaimonic well-being. Work, in particular, can contribute to positive eudaimonic well-being through providing feelings of being competent in carrying out one's tasks, having autonomy in the way in which one carries out one's job, and through interactions with others, which I refer to on the slide here as relatedness. So what are the determinants of a good job? Well, first of all, safety is really important, and autonomy is important because people like to feel that they're in charge of what they're doing and how they're doing it. A job must be interesting to be thought of as a good job. A good job gives you esteem. When you meet someone for the first time, often their question is, what do you do for a living? And self-esteem is really important in this one. Self-realization is important, and of course work-life balance. And I should stop here and pause and think a little bit about what's happening during the COVID pandemic, in which for a lot of health workers, work-life balance and safety have been two key things that have been jeopardized. Social interaction at work is very important for a lot of people. They go there to interact with different people, often like-minded people. Low emotional stress makes for a good job. Good wages is not always thought of as the most important factor, but it is a very important underlining factor, especially if you don't get good wages. Low risk of litigation is important. If you're always worried about being sued, then that's going to be a problem in your work. Good quality output, and we'll come back to this of course later on. Good quality output makes you have pride in your job, and output that contributes to the common good can make you feel much better about your job, and we'll talk about that again soon too. So, are jobs in health and social care good jobs? To answer this, we'll look at doctors, followed by nurses, and then care workers. And we'll use job satisfaction as a proxy marker, as an indication of a good job. So, with doctors, job satisfaction is strongly positively correlated to hourly wage and the salary they receive. It's negatively correlated to the numbers of hours worked per week, to their workload intensity and the volume of work. But importantly, job satisfaction amongst doctors varies according to speciality within the field. The differences can be linked to the peculiarities of each speciality, as well as the way wages, hours and workload play out in each field. So let's look at a couple. First, obstetricians and gynecologists. So they generally have low job satisfaction, and this can be attributed to various factors, which include emotional exhaustion, fear of being sued. They tend to suffer lack of autonomy due to not having control over their schedules and working hours. They report that they lack adequate time with patients and that there is restricted availability of high-quality ancillary services. And furthermore, the pay is lower when compared to other specialities, and this can be a cause for discontentment. At the other end of the patient's lifespan, geriatricians generally report high job satisfaction due to relatively regular working hours. They frequently report good personal relationships with their patients, and they often also report satisfaction in that they feel that they are needed both by their individual patients and by wider society. Now, if we move on to nurses from the doctors that we've just discussed, the picture is different. Generally, nurses report low job satisfaction, and the most common cause of this is stress. Other contributing factors include high workload and long working hours, and this, of course, in itself adds to stress. Studies have also found that low job satisfaction is caused by the management styles the nurses have to deal with, along with poor relationships with their managers and sometimes with their fellow workers too. Finally, nurses report emotional exhaustion, and for many nurses this has been exacerbated while nursing patients suffering from COVID. I've heard quite a lot of interviews on the radio from nurses who are just emotionally drained. Finally, it's worth noting that the link between pay and nurses' job satisfaction is contested, and we'll talk a little bit more about pay later. Care workers generally report high intrinsic motivation. However, high workloads, which stem from the shortage of care workers, tend to reduce their job satisfaction. For example, in the UK, care workers are at times asked to do home visits in just 15 minutes. And one has to ask oneself, how can this be considered satisfactory or even adequate? The shortage of care workers can be attributed to low pay and poor working conditions. Indeed, in a study of the UK in 2019, Roberts and colleagues found that over 50% of all care workers were paid less than the real living wage. It's been argued that care workers view their work as a public service and that they find job satisfaction more in the fact that they are helping people than in the relatively poor monetary rewards. In line with this, Morgan and her co-authors have suggested that while care workers may be satisfied with their jobs, they are often unable to make ends meet on their low pay. And as a result, they are forced out of care work, which they find satisfying, simply by their inability to make a living. So, are jobs in the care sector good jobs? We can see that some of the determinants of a good job that we looked at earlier are innately met by the job. Some are lacking and need attention, and for some we have a very long way to go. In particular, COVID has highlighted alarming concerns about safety due to the lack of personal protective equipment. Now, let's move on to the final property of the sweet spot of good work, that a sweet spot should provide lots of jobs. And this is, of course, linked to the issue of good wages. So why is the cost of the care sector perceived to be unaffordable, and hence the sector is starved of workers? So William Baumol has written a book called The Cost Disease: Why Computers Get Cheaper and Healthcare Doesn't. Baumol splits the economy into a stagnant sector and a productive sector. The productive sector produces things like computers, mobile phones and cars, while the stagnant sector provides services such as health and social care, education and the arts. In the productive sector, due to technological innovations and automation, productivity growth is achieved by producing more output per hour worked. In other words, more and more computers can be produced per worker. But the stagnant sector is characterized by being labor-intensive. Labor productivity gains are far harder to achieve in this sector if quality is to be maintained. For example, in social care and teaching, face-to-face interaction is required, and the quality is to a certain extent time-dependent. We had the example earlier of care workers being asked to do home visits in 15 minutes, and this inevitably means that the quality of the visit suffers. Likewise, if performers in the arts were asked to do more and more gigs faster and faster, the quality of their performances would deteriorate. The differences in the productivity of the two sectors is shown clearly in this graph, where the productive sector is represented by manufacturing and the stagnant sector is represented by health, education and government services. It shows that the productivity of the manufacturing relative to the services sector grew by a factor of 6 between 1950 and 2010. And here's a key point about the stagnant sector. Although output per hour in the stagnant sector does not increase, it has to compete for workers with the productive sector. And therefore, because it is more labour intensive, costs rise. After all, if we think about it, if salaries are not reasonably competitive, we'd get more and more doctors changing careers to become city bankers. So the net result is that over time, costs in the stagnant sector become relatively higher, as we'll see on the next. This graph demonstrates Baumol's point. It shows the price of physician services in the US in blue and the Consumer Price Index for the US in red, both calibrated to 100 in 1948. It shows that the price of doctors' services rose around 2.7 times more than the CPI, and that's why we perceive doctors' services as expensive. Now, while it is generally agreed that Baumol's cost disease is the primary reason why costs have risen in the health sector, there are, of course, also some other reasons, and these include an ageing population in Western countries, costs of litigation, in particular in the USA, technological changes that involve expensive equipment and drugs, and this is all combined with the high prices charged by pharma companies. But what does this mean for workers in the sector? While healthcare costs have risen, wages haven't, and over the last 50 years, healthcare workers' salaries have barely kept up with inflation. So up till now, we've said that that the health and social care sector is part of the stagnant sector. But now let's challenge that assumption. Can we try to convert the care sector from being a stagnant sector to a productive sector by replacing human beings with technology? This brings us to the question, how likely are jobs in the care sector to be replaced by automation? Artificial intelligence, machine learning and use of big data are growing fields of research in medical diagnosis. Currently, physicians use personal histories, individual biomarkers, simple scores, scans, and physical examination of patients to make a diagnosis. In contrast, artificial intelligence uses complex deep learning algorithms drawing on big data, which can include extensive data sets based on evidence from millions of patients. Use of automation can draw on far larger and more up-to-date data sets than can be processed by any one human being. And so automation in the field of medical diagnosis is likely to proceed. But what about other fields? Let's take a few examples. We'll look at GPs, physical care and mental care. A company called Babylon has launched an online AI-powered triage and diagnostic system called Chatbot. It was launched in 2017 in London and now has nearly 80,000 registered users. The types of outcomes are shown on this graph. Around 27% of users are given advice leaflets, 14% are able to self-manage their illness, and around a quarter of users are referred to a GP, with 12% being recommended to go to hospital. So, will Babylon replace GPs? According to Dr. Noble, who's the Associate Medical Director of Babylon Health, AI cannot replace the physical human care that comes from being examined in person by a GP. This is because it's unlikely that a system of sensors linked to an AI system can yield the valuable information that traditional physical examinations can provide, especially, for example, in examinations that involve high-level interaction and critical thinking in areas such as neurology. Let's move on now to physical care, in which we have Carebots. Graeber, pictured here, is a plastic and metal robot, and he's able to lift patients in and out of bed. He can place them in a wheelchair and he can assist them with walking. So while Carebots may supplement the work of nurses and carers, they are unlikely to be a substitute for them. One of the reasons for this is that Carebots involved in lifting patients need to be extremely heavy and therefore will be mainly deployed in care homes and hospitals rather than in private homes. According to Martin Ford in his book The Rise of the Robots, the realization of a multitasking robot that can autonomously assist people remains far in the future. I love this slide. It shows Paro, the therapeutic robot, or this is often known as a socially assistive robot. Paro is a type of socially assistive robot who provides mental care. He's in the form of a furry baby seal. He responds to being petted by moving his tail and opening and closing his eyes, and he can be held and he can be hugged. Robots like Paro have a wide variety of uses. For example, many older people suffer from isolation and mental impairment, including dementia. And this type of robot can be particularly useful in these situations. They're useful in other conditions too, such as depression. And it's easy to see that during this COVID crisis, when many people are suffering with isolation, that Paro could perhaps have been playing a role, or maybe he is playing a role. So what does all this mean for future jobs in the health and social care sector in Western economies? A study by the Bank of England last year suggested that there would be reductions in physical and manual jobs and jobs that use basic thinking and reasoning. In contrast, they predict an increase in jobs that use the type of skills that are needed within much of the care sector. They predict increases in jobs involving technological skills, higher thinking and reasoning skills, and importantly, those involving social and emotional skills. From reviewing the literature, we can conclude that rather than destroying jobs, technological advances will change the function and nature of jobs. The main reason for this is the irreplaceability of genuine human interaction by machines. This brings us back to the nature of jobs. Will they be good jobs? Introduction of technology is unlikely to change many of the properties of jobs in the care sector that already make them good jobs. But when we look at the more problematic features, we can see changes. For example, it's reported that AI can be used to give second opinions, and this may give workers stronger legal protection and thus reduce the risk of litigation. Also, automation may provide alerts that reduces mistakes, and so safety may be increased and stress reduced. But we can foresee that good wages will remain a problem for many workers in the sector. It's not clear how AI and robotics will impact wages, and we should remember here that it's low wages which drive many care workers out of the sector. In theory, the use of technology could reduce costs, freeing up resources to improve wages. However, AI and automation may result in reducing the importance of hard diagnostic skills used by care workers. This could drive wages down, as it may end up shifting the work further towards the softer skills, in other words, skills involving social interaction and empathy. These softer skills are traditionally feminine skills, and they've been historically undervalued. And it's not clear yet what effect COVID will have on this issue. So let's pause a moment here and pull together what we've been talking about and what we can learn from it for sustainable lifestyles. Beaumont's cost disease can be viewed as bad news for sustainable lifestyles. Ever cheaper goods from the productive sector encourages people to buy more and more stuff, and this consumerism harms the environment. At the same time, in the stagnant sector, we cannot get away from the labour intensiveness of the nature of care work. It cannot and should not be dehumanised. We need to protect jobs in the stagnant sector, and this will be important as we navigate our way out of the COVID crisis. This brings me to the conclusion of my talk. So, what can we learn from COVID for sustainable lifestyles? COVID has shown the precarity of our lifestyles, and we're now at a tipping point as we forge our new futures. This isn't a once-off. Pandemics similar to COVID, caused by other zoonotic diseases, are likely to occur with higher frequency due to our increased urbanisation and industrialised agricultural systems. Before we explore what we can learn from the COVID pandemic for our efforts to tackle environmental threats such as climate change, it's worth first reflecting on the differences between the two. First of all, the reality of COVID is indisputable. It causes immediate, identifiable deaths. In contrast, climate change is distant and global in nature, and it's generally hard to nail the cause of specific extreme weather events onto climate change. Another difference is that COVID is an acute episode. It probably only requires short-term changes to lifestyles, whereas climate change is a chronic condition requiring permanent changes. But despite these differences, there is a great deal we can learn from COVID. One of the rare silver linings from COVID is that the public and politicians alike are now much more familiar with listening to experts. In the UK's regular updates, we have become accustomed to scientists standing alongside politicians, explaining their modelling outcomes, using graphs, and even explaining some uncertainties. At the time that I'm recording this, most, if not all countries, are keen to show that their policies are based on scientific evidence. And they're keen to show that their policies have the backing of scientists rather than being based on dogma, even if the scientists may be carefully handpicked. Another important lesson that has been learnt from COVID is that delay in action can be costly. Countries that denied the science and delayed lockdown have arguably suffered more from COVID, at least in the short term. Of course, the jury is still out on what may happen longer term. COVID has also raised awareness of what we value in our lives and the shortfalls that became rapidly apparent when the virus hit. The shortages of healthcare workers and the fragility of our food supply chains. And being in lockdown has raised many people's awareness of how they value their family and friends and of the importance of their local communities for looking after the vulnerable. Although healthcare may appear to be costly, as Baumol's cost disease has shown us, this is only a relative effect. What we spend our money on, both publicly and privately, is a matter of choice. Indeed, as Helen and Tabarrok say, spending more on healthcare is a rational response to higher incomes. But one of the most striking things we've learned from COVID is that fast, radical action is possible. At a governmental level, governments of all persuasions have imposed restrictions on the movement of their citizens and embarked on unprecedented financial support packages. And at a personal level, while many environmentalists have been struggling with theories about how to change lifestyles, in a few short weeks, we've seen people across the world changing their behaviour to act for the common good. We must seize the opportunity to learn from this sad episode. We need to take positive action from it. We need to build a more resilient, sustainable society. And a key component is jobs. We need jobs, plenty of jobs, as jobs contribute to our well-being, as well as providing a livelihood. And we need the right kind of jobs, jobs that contribute to the good of society and that do not destroy the environment. In this presentation, we've seen that, due to Baumol's cost disease, health and social care will always appear expensive. And there will always be a downward pressure on numbers of workers. So we need government support. And although this presentation has focused on healthcare, this applies to many other of the so-called stagnant sectors, which offer the opportunity to provide plentiful, low-carbon jobs that are good for the planet and good for societal well-being. So while the advent of COVID has been tragic and we mourn every single death, we need to take some positive lessons from it to build a more sustainable, resilient future. Thank you for listening. Before we take questions and before I show you the references, I'd like to say a big thank you to Simon Mayer, one of my colleagues, whose input to this talk has been invaluable. And I'd also like to make a quick disclaimer that I recorded this on the 25th of April. And as we all know, events during the COVID crisis are unfolding very rapidly. And so some of the examples that have been given during this talk may become outdated.
Hi. Alyosha, is the video still running or are we on?
You're on.
Okay. Great. I just wanted to wait a brief second because someone gave me an indication that the video was like a few 30 seconds delayed or so. Thank you so much, Angela, for your talk. It was really interesting, and I see that it was also interesting for other people because we got plenty of questions. Maybe you could follow already in the chat box.
I haven't seen any questions in the chat box.
Okay, well, I will.
Oh, I was looking at the bottom, not the top. Oh, bother.
Okay, no, don't worry. I've been collecting some questions, and I'm trying. No, there's more coming in, but I will just try to give them some structure. So I would actually like to start with one question by Joel because it's quite interesting regarding the topic of the conference. And he's asking, what would the automation of jobs in the healthcare sector mean in regard to the environmental impact of this sector? Because now you were talking about the sector giving the opportunity for a lot of jobs with low impact, but would this actually increase the need of resources and the amount of emissions?
So that's a really, really good question, which I did gloss over. And of course, the graph that I showed you from Jackson and Victor's work was looking at historical data. You're absolutely right. As we go towards more AI, for example, more energy will be used. In particular, when you train an AI, a new AI system, it's very, very, very energy intensive because it goes through tons and tons of tests and it has to go through a whole learning process. Likewise, robots, etc. You know, the robots to help move people around, the care robots can be very energy intensive to build. So yes, we will have environmental damage from increased automation. On the other hand, I would reckon it's all relative to the other types of jobs, and other types of jobs have historically been automated more than the healthcare sector. So I think it's something we really need to keep our eyes on, and it's a balancing act, like with everything.
Okay, thank you. Maybe a quick question also related to the robots, because Jan is asking whether there are any studies about the acceptance of the cuddly-looking robots. I think she was talking about the little seal robot, and if you know where they are used currently.
So this is like Paro, the seal, who's like cuddly.
Yeah, exactly.
Yeah, I believe they are, mostly in Japan and places like that. And so the literature says that they can't replace human beings and things, which I think I would agree with. But if they're used in conjunction with human beings, I mean, if you just take the COVID crisis and lockdown, if you think of a person who's being so isolated, living on their own, okay, they can chat to people, but actually to have some sort of Paro robot around, I think could have played a role. And I think these things will get reevaluated now. But that's a personal opinion. And I'd need to look into the literature more. They are definitely used, but the jury is still out on how effective they are.
All right. You mentioned the COVID crisis in your talk. I know it's been a very central concern to you. That's why you wanted to talk about it today. And there were also a lot of questions actually relating to the current crisis. Maybe I can try to give you some of them at once because they go in a similar direction. Graham, for instance, asks whether within the realm of health service jobs, if you agree that nursing is crucial and tremendously undervalued right now and underpaid, and how this could be rectified. And then we have similar questions, one from Caroline Werfurt, I hope I'm pronouncing this right, who wants to know if you think that there will be a transformation in the conditions for nurses and care workers after the COVID-19 crisis, and also other key workers in other sectors. Yeah, maybe we keep it with those two. for now.
So, yes, I think to both of those questions, I think COVID's been absolutely dreadful, but it's really highlighted what we need to underpin a good society, to underpin high well-being lifestyles. And so I think governments, since the Second World War, the UK government had certainly not drawn up a list of key workers that underpin society. And all of a sudden they had to. And that was people like teachers, people like the people who collect our rubbish, and of course all the healthcare workers. And these are all traditionally poorly paid. I think there's a lot of discussion about how we can improve wages and support these more. There's the whole discussion about whether we'll move towards a universal basic income, UBI. There's also an enormous danger, because as I see it, economies are going to be absolutely bankrupt by the COVID crisis. And how are they going to suddenly increase the payment of care workers and the people collect our rubbish, etc., etc., etc. It's a really, 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 really tricky problem. And I think it's been highlighted. What we'll do about it is out. We need to watch and see.
Yeah. Maybe one follow-up also regarding the crisis, because Marion was wondering whether the data that you were showing was when she was talking about doctors' satisfaction, but maybe you can briefly talk about the different graphs that you've shown, if it's global data or UK data, and if it's UK data, how it could vary across countries. And there have been some other people like Jessica and Ivan Sabine asking also between the national differences. So Jessica wonders whether centralized structures have advantages over federal structures, like in Germany, for example. And similarly, Ivan mentions the lower mortality rate now during the crisis in Germany compared to the UK or France. And if you think there are any lessons to be learned from that.
Wow, what a lot of really good questions there.
Yeah.
So the literature, I mean, I basically searched the literature international from peer-reviewed journals from the last 10, 15 years. And my focus wasn't to do an inter-country comparison, so I can't answer the questions like that. The question about centralized and decentralized healthcare systems and things leads on to resilience. I don't know if you've heard of the work of Hilary Cottam, who's tried out some sort of healthcare systems in the UK, which is really much more decentralized, much more based in the community. I think that kind of system is going to prove welcome as we move forward, that it's more based in the community. She's come up with ideas where people within the community are trained on first aid and have rough medical training, so that people are much less reliant on going to the real professionals, but people can deal with things a lot more themselves. And I think that kind of system, and of course, and also people help each other, much more communities scale. And I think this has potential now because of what we've been shown by the coronavirus, and also the funding that we're going to be facing, or rather the lack of funding that we're going to be facing as we go forward.
Okay, thank you. Yeah, maybe also one more question about this regarding public funding and also policies, because Jeroen Vandenberg asks, I mean, he doubts that that we can achieve a large shift between different activities on a macroeconomic level just by promoting some jobs basically as nice jobs, at least in the short run. So he says we seem to be limited by the self-organization of the macroeconomy, driven by complementarity and differential productivity, referring to Baumann's disease that you mentioned. of different activities. So he would like to know what your thoughts are on this kind of system angle, and what are the associated implications for public policy. You already mentioned the financial problems that countries are facing now. So what do you think we could do, actually?
That's a big, deep question. I think we are seeing some structural shifts between sectors. For example, the aviation sector is being quite vociferous in saying it's almost being destroyed and it's in huge jeopardy. So I think there is a chance that we will shift between sectors to a certain extent. On the activities, the shift between jobs that are good jobs and the jobs that aren't good jobs, I mean, like Graeber's bullshit jobs. I think if you look at the younger generation, say the sort of under 30-year-olds, there is a move towards doing work that has purpose, social purpose, environmental purpose. There's a move away from working really, really long hours in the city and actually having no life balance. We have yet to see how that plays out when these younger people are saddled with families and mortgages and all that, whether they'll still go for the high-paid, non-rewarding jobs. But I do see hope there that the younger people are, you know, they're seeing the climate crisis and things. I mean, this was before COVID, beginning to reject their very, very high-paid jobs, which don't add social value.
Okay, thank you. I'm just looking through I have some more questions. I'm looking through the chat again, because now there's still questions popping in. And there's, I think, one interesting one also from Sasha, who mentions that your conclusions focus mostly on developed countries. But especially in low and middle income countries, a lot of the indicators of good jobs that you mentioned are a lot worse than here. So how can circumstances be improved in countries where technical advancements are not as likely to be financed in the near future? And what your perspective is for these less privileged countries?
Okay, so Sasha, I should have made a declaration at the beginning. I completely forgot, and you've highlighted it, that my talk was actually focused on developed countries, and it doesn't really apply to developing. Well, actually, I mean, we need to think about it. I haven't actually applied my work to developing countries because I recognize that things are very different. The determinants of good job will be exactly the same. You know, this is the basics, but I haven't got my head around the other questions. So I think it'd be better to go offline and discuss that rather than me having to get my head around a whole different world in no time at all in front of everyone.
No, of course, no, don't worry. There's also, we're almost out of time, but there is always the option to move the discussion further in the Discord channel.
Absolutely, yeah.
I would like to ask something that I was thinking about from my side personally, between coming back to the link between lifestyles and jobs, because you're not so focused on that in your presentation. Maybe you could elaborate a bit more. For me, I'm trying to wrap my head around a bit whether our jobs are more a result or a determinant for certain lifestyles. What is your take on that?
Okay, so basically you're asking why are jobs and my whole talk relevant to lifestyles. So as we've seen, when jobs disappear, it affects whole lifestyles. It affects the person whose job has disappeared, and it affects everyone else because we've been relying on some of those jobs. So a job is an important contributor to subjective well-being. As we've seen, the people who have lost their jobs, they're absolutely desperate. And first of all, because their livelihood is in jeopardy, but also because a job is important to you for many other reasons. And that's, you know, what I've put those circles of the determinants of good jobs. And jobs are important, which jobs we do are important for building our society. Yes, we do need the sectors where the jobs are carbon intensive. You know, we still do need a certain amount of oil-fired power stations or gas-fired power stations because we can't go to renewables quickly enough. But good jobs actually underpin everything in society. I think this is one of the things that COVID has thrown up, is that without a job, your personal lifestyle is destroyed and the functioning of the society depends on having the right jobs and the good jobs. Does that answer it at all?
Well, yeah, to some extent. I mean, I totally agree with you about the importance of work determining the lifestyle, but I also see that it's a very difficult question, no, to approach because, to answer in a simple and straightforward way, because you have a lot of relationships going back and forth between your jobs and what happens during the rest of your life. And well, I see that there's no straightforward, easy answer to this. One thing I would also like to mention, a comment comes from Lauren. She's wondering if anyone else is having a reaction to these sectors being differentiated between productive and stagnant. She feels that this falls under the same type of narrow thinking that has GDP disregard hidden costs that should be included, like environmental costs, inequity, etc. And she says we need to challenge what is considered valuable and important. I guess and of course good, which you probably agree with. So maybe you could just give a brief reaction to that.
Okay, so the productive versus stagnant is just a way of thinking about things. I mean, a lot of my work looks at GDP and how GDP is flawed, and I would agree on all these things. And I hope the classification of stagnant versus productive, okay, it's very black and white, but it goes to the fundamentals of what, for example, the UK economy has been focused on in the last 10 or so years, which is productivity. The UK economy will do anything to up their productivity. And looking at stagnant sectors makes you value that actually productivity isn't what we want. We want good jobs, we want well-being. And actually, I think by looking at the productive versus the stagnant sector, it does anything but underline that GDP is important. It actually underlines that GDP is not what we want, productivity is not what we want. What we want is high well-being.
Okay, thank you, Angela. We're unfortunately out of time. There are so many more questions, but I hope that you will be available later or at some point during the rest of the conference on Discord. So please, everybody whose questions I could not bring up, ask them to Angela in the channel, if that's okay for you.
Can you keep them from the chat? Save them?
Yes, we have a transcript from the chat as well.
Sure.
Okay, thank you very much for joining us and for the great talk, Angela. And we will move on to the next session.
Can I just say a huge thank you to Franziska and to everyone for listening.
Okay, great. Everybody, Alyosha, the facilitator, will forward you back to the Discord forum, and then you can join the next sessions from there. Thank you all for listening. Bye.